At that time, at which time there were only 2 of these platforms in the United States. Today they are ubiquitous, they're all over the place. And starting with urology, Dr. Menon operates on urologic cancer, particularly in the prostate. Starting with that, the application spread to our cancer, also bariatric surgery for obesity, ear, nose, and throat, where at our institution, Dr. Tamir Ganem is performing surgery on probably some of the largest head and neck tumors that anybody has been doing with robotics. And also in thoracic surgery, particularly for lobe resections of the lung, and also for surgery of the esophagus, which are very, very difficult surgeries to do. And the robot has proven to be a great enabler for doing those surgeries with small incision approaches. So Dr. Menon started this. When I learned that he was doing it while I was building our division of minimally invasive surgery, I sought a meeting with him and I asked him to train me, and he agreed. And I spent, actually as a gynecologist, I spent a lot of time assisting in prostatectomy so I could learn what the technology was all about. The FDA in the United States approved the application of the robot for gynecologic use in 2005. For my Omecta institution, we have trained now 7 gynecologists, 1 urogynecologist specialist. We have 4 specialists in gynecologic cancer, as well as 1 reproductive specialist who we've trained in robotics and are performing their surgeries with this technology. We perform at our institution now across 3 hospitals, probably between 400 and 500 procedures a year. It's growing particularly in the cancer areas where our greatest growth is right now. In terms of urologic cancer, our greatest volume is there, particularly at the main campus in Detroit, and the Vanakuti Urological Institute, headed by Dr. Menon. Surgery, partial nephrectomies, they're doing all manner of reparative surgery in terms of implanting the ureter, in terms of removing part or all of the urinary bladder, particularly for cancer indications. And we have 2, probably the most prominent urologists at 4 doing those kind of things with Dr. Menon. In gynecology, we started focusing on myomectomy, which is a procedure wherein benign tumors of the uterus, which are composed primarily of smooth muscle tissue, enlarge the uterus, can cause pain, pressure, they can cause bleeding problems for the woman. And for the woman who wants to preserve her ability to have a baby, myomectomy is a procedure where the tumors are removed and the uterus is repaired so that she can have fertility. Doing this without a large incision can be quite difficult. There's a lot of suturing involved, a lot of dissection of the uterus, and there's a lot of clinical study and publications, especially in the 1990s, that show when you try to do this operation with laparoscopy, meaning small incision surgery, with the instruments we have available, results could be less than optimal. There were a lot of reports of uteruses which would tear open during labor. There were, after this kind of surgery, there were reports of uteruses that had what are called fistula. Fistula are where there's a connection from one body cavity to another that shouldn't be there. And I remember particularly in 1999 seeing a report of a woman who had had a myomectomy this way.